Welcome back. Lung cancer causes the most cancer deaths in the US. Screening is a highly effective way to detect it early when it's most treatable. Sadly, only 6% of eligible patients get screened, leading to preventable deaths. Joining us for more information is the Assistant Professor of General Thoracic Surgery at UC Davis Health, Louis A. Godoy. Thank you so much for
Hi,
joining me
good
today.
morning, Brittany.
Good morning. So,
Thank you for the opportunity.
So to start off, can you explain what National Lung Cancer Screening Day is? This is the first I'm hearing of it. And how does it help raise awareness about lung cancer?
Yes, well, as you mentioned, lung cancer is the biggest cancer killer in the United States. Kills more people than prostate cancer, breast cancer, and colon cancer combined. And each year, approximately 130,000 people die from this disease. That's equivalent as a 747 jetliner crashing each and every single day. So it's an extraordinary amount of people who are dying from this potentially curable disease. National Lung Cancer Screening Day. Actually, this year it coincides with Veterans Day. It's on November the 11th. And it's a day that's supported by the American College of Surgeons, in addition to other organizations, to where we want to increase the awareness for this lung cancer screening tool, which is a low dose CT scan to help detect cancer in the early stages when it's easily treatable.
When it comes to lung cancer, as you mentioned, it's a major cause of cancer related deaths here in the US. So, can you give an overview of the current situation regarding lung cancer diagnosis and treatment?
Yes. Actually, the number that you mentioned, the 15%
Mhm.
of people actually getting screened, that's in the high performing states. When we look at the national average, it's really only about 6% of patients who qualify for it are actually getting screened. Now, in California, sadly, where I'm at, that screening rate drops down to about 1%. So we definitely have a lot of work to do in order to increase this life-saving tool. Unfortunately, since patients aren't getting screened early on, the majority of lung cancer detected nowadays, so 75% of lung cancer diagnoses are at later stages, where we know that outcomes are not as great as if they were diagnosed in the earlier stages. So we're trying to flip the role by increasing awareness of lung cancer screening to help diagnose people earlier on.
That's really interesting that you mentioned the 15% is in within the high performing states, and then there's this huge gap of 6% and even 1%. Can you tell me what are some reasons for not getting screening? Maybe A, they're not aware that they should be going for screening, maybe they don't qualify or not eligible with insurance, or maybe they're just scared, maybe they're just hesitant to doing so.
Yeah, I have had several patients who have come to my clinic who, just like you mentioned, were scared about what they were going to find.
Hmm.
And so it was at the prompting of their family members that they were suggested that they go ahead and get screened, and they just happened to detect a lung cancer. So the fear is one thing. There's also a social stigma. People see lung cancer as something that's self-inflicted, related to smoking. But there are other causes of lung cancer that we also know about. Radon gas, for example, is an environmental exposure that can cause lung cancer. Asbestos exposure is another known risk factor as well. So we want to spread the message that lung cancer screening, it really can save lives. It's non-invasive. It's a relatively quick and easy test to get, and to please talk to your doctor if you meet the criteria to get screened, because it can really save your life.
Absolutely. So let's talk about that. Who should consider undergoing lung cancer screening?
So the guidelines at this point are anybody who's 50 or older,
Hmm.
either a current smoker or a former smoker, with a 20-pack-year smoking history. Now, the calculation can be a little tricky, so anybody who feels that they kind of meet this criteria should really talk to their doctor so that they can run through the calculations with them to make sure that they qualify for screening. But really, it boils down to 50 or older, current or former smoker should talk to their doctor.
Yeah, absolutely. And now let's talk about smoking, right? And let's kind of remove that stigma around it. And so, can you tell us a little bit about why quitting smoking is important, not just for preventing lung cancer, but your overall health?
Yeah, so smoking we know is the leading cause of lung cancer. But
Hmm.
aside from that, there are other health aspects that it can affect. So it affects all aspects of your body. So we know there's increased risk of cardiovascular disease, increased risk of stroke, increased risk of, for example, wound healing if you go for a general procedure or another operation. Even though you don't have any issues with your lung, you may be at increased risk for infection. So all of these factors are affected by smoking in a negative way. So for anybody who is interested in quitting smoking, there are several resources that are available. Just like we treat lung cancer, we have surgical specialists, we have oncology specialists. There are specialists who help patients quit smoking with the arsenal of resources such as medications, counseling, social support groups. So for anybody who's interested or wanting to have more information, they should really talk to their doctor about getting referrals placed for these.
Yeah, of course. And so, your organization, American College of Surgeons, they also assist people in quitting smoking. So, can you talk a little bit about the resources? Are the resources available? Some of the same resources that you mentioned. What do you guys offer?
Yeah, so we actually compiled a list of resources
Hmm.
that one can go to, and it's at our website. So www.facs.org/lung cancer. And there they will find information on both lung cancer screening and smoking cessation resources as well.
And given your work, can you share a story about somebody who has quit smoking after a cancer diagnosis, and how did it impact them, their treatment, their survival? What was that impact like?
Yeah, we know that smoking is a very, very difficult thing to quit. It not only changes the body physiologically, we know that it's not a matter of willpower,
Hmm.
but sometimes it has taken a diagnosis of lung cancer for a patient to open their eyes and say, like, wow, this smoking has cost me part of my lung now. And I have had patients who at that point were then motivated to quit smoking and fight that uphill battle. I've have several patients who have been very successful with smoking cessation after a diagnosis. So one of the things I want to emphasize is that it does not matter. It's never too late to quit. Even I've had patients even up until the day of surgery, that smoked and quit on the day of surgery. It's never too late to quit.
100%. And we know that quitting smoking, you kind of alluded to it, it's no easy feat. So, can we talk about some of the challenges that smokers may go to when trying to quit?
Yeah, I mean, one of the biggest challenges that I face with my patients is the ingrained social aspect of smoking. It becomes a social thing where if your friends smoke, you tend to smoke, and even though you're trying to quit smoking, if you go out and go to a party or go to a friend's house and they're smoking, you're more inclined to smoke. I think that's been one of the biggest challenges that some of my patients have faced
Hmm.
when their families are supportive. Even though there's another smoker in the family, we have found that people are more inclined to quit smoking when they have a strong support structure.
Yeah, absolutely. And as we wrap up, I just want to thank you for taking the time to educate us today on lung cancer and, the benefits of quitting smoking.
Thank you for the opportunity.
For more information, you can visit their website at facs.org/lung cancer. Don't go anywhere. We'll be back with more open right after this.